Good morning. For our assignment today, the first thing we're going to do is discuss the use of mental imaging or mental practice process when teaching motor skills. The definition is mental imaging involves the creation or rehearsal of a vivid mental representation of performing a task. It engages many of the same neural pathways as actual physical practice. The mechanism, neuroimaging studies show that imagining a movement activates areas of the brain like the primary motor cortex, the premotor cortex, and the cerebellum, similar to actual movement. This helps strengthen neural connections for skill performance. Types of mental practice. There is visual imagery, where you're seeing yourself performing the skills step by step. Kinetic imaging is the feeling the movement in the body as if you're actually performing it. To use this in nursing education, nursing involves much fine motor skills such as inserting IVs and administrating injections, and complex procedure skills such as sterile technique and CPR. It allows the nurse to practice risk-free, no patient harm. We love that. It increases preparedness and confidence. It also supports muscle memory. So how can we apply it to nursing? We can have the students visualize performing a procedure correctly, such as setting up the sterile field. Students can mentally rehearse these skills. It improves skill performance, it enhances retention, and it also reduces the anxiety in the student. Implementation. We guide the students through the mental rehearsal step by step. We do it in like 5 to 10 minutes of mental practice a few times a day. And we also combine it with our physical practice. Evidence. Using mental rehearsal resulted in nursing students performing better on exams. Mental practice reduces anxiety and increases confidence during patient interaction. Combining mental and physical practice leads to faster mastery than physical practice only, so it's definitely useful. In summary, mental imaging is a powerful tool for teaching nursing motor skills. It provides a cost-effective, safe, evidence-based method to enhance the skills, increase the confidence, and ensure retention. Excuse me. The second question is develop an interprofessional case scenario that would be appropriate for undergraduate nursing students. The case scenario I chose would be Mr. Smith with post-operative complications. It's a 68-year-old male. He has a history of hypertension, diabetes, and osteoarthritis. 2 days ago, he had a right knee replacement. The nurse finds the patient short of breath, saturation of 92, fever of 101, and swelling and pain in his right calf. The tasks for the students include assessing the patient, collaborating with team for anticoagulation pain management, educating patient on DVT prevention and treatment, and documentation. This scenario encourages the students to engage in interprofessional communication, critical thinking skills, and patient-centered care. The next question was to describe a clinical situation that could reasonably be translated into a simulation. Which type of simulation would be most appropriate? What psychomotor and cognitive skills would you hope that they would achieve? How would you envision your role as the educator, and what would you include in the debriefing? So the clinical situation for nursing students is a patient that is having acute chest pain due to a possible MI. Patient presents to the emergency room with shortness of breath, anxiety, chest pain, and diaphoresis. Vital signs shows a high blood pressure, tachycardia, and a low oxygen saturation. Patient's history includes diabetes and hypertension. The scenario is good for new nurses because it combines the critical thinking and technical skills together. I would use a high-fidelity simulation with a mannequin. I believe that's most appropriate. This type of simulation can mimic different vital sign changes, and also cardiac rhythm changes, and how the patient responds to treatments. Skills the students would practice include vital signs assessments, EKG performing and interpreting, administering oxygen, starting the IVs, possibly using the AED, and applying safety protocols. Cognitive skills the students will use include recognizing the signs and symptoms of an MI, prioritizing their intervention using clinical reasoning, developing an action plan, communicating with team members, and educating the patient. My role as an educator is to guide the students and support them during the simulation. During debriefing, I would allow the students to express their emotions and feelings on the simulation, what worked, what could be improved, and identify any future learning goals. Number 4 is to construct a statement or scenario that could be used as the basis for a debate in an undergraduate nursing ethics course. I actually came up with 2. The first one is an 82-year-old female. She's been in the hospital multiple times for congestive heart failure. Cardiologist recommends a high-risk surgical intervention, and it can prolong her life for a few months, but it has many, many risks. The patient does not want the surgery. She feels that the cost of the surgery will be a burden on her children, and her children want her to have the surgical intervention. So the nursing staff is kind of caught in the middle, trying to respect the patient's feelings and also supporting the family. So positions for debate would include pro-patient autonomy, pro-family and pro-intervention, and how we're going to negotiate. What approaches are we going to use? At first, I really liked that one. Then I actually chose a second one, and that's something that the nursing students, when they get on the floor, are going to deal with, and I don't think that we prepare them enough. So the scenario would go, a nurse reports for work. There's a critical staffing shortage that day. She's a med-surg nurse that usually takes 6 patients. Today, she's going to have 10. Also, 2 of the 4 CNAs have called off, so for 40 patients, there's only 2 CNAs. So basically, the nurse will be doing primary care on 10 patients. Then she's assigned also to be a preceptor of a new nurse, which is time-consuming. So the questions that they could debate are, should the nurse accept that particular assignment? What are the ramifications if she does refuse the assignment? And if she does accept the assignment and something happens to one of the patients because she doesn't have the time to be a proper nurse, should she be held accountable? And so I think with the fact that in 2030, all of our baby boomers are going to be over 65, and so many nurses are leaving the field, this is something that a lot of nurses are going to face. And I think having the opportunity to discuss it in a classroom and debate it is a good idea. It gives them time to think through maybe what their reactions will be before they face it, and they will face it. So number 5 is to create a game to help learners review the instruction methods discussed in this model. So the game would be instructional method matchup. Different instructional methods will each be written on an index card, as well as the definition for those methods on a separate index card. The learners will be divided in small groups, spread the cards face down on the table, and each learner tries to flip over 2 that would match, which would be the method and the definition. And if they get a match, they get to go again, and the one with the most cards at the end wins. And that is all for today. Thank you so much.